Welcome back to Learning Pathology with Dr. Bhavana. Our next video in the practical series is about blood grouping. Blood grouping. We classify the blood group systems into major and minor. Major, the most common is the ABO blood group, discovered by Carl Linston in 1900. RH blood grouping or the rhesus blood grouping, MNS, P. The minor blood group systems are Duffy, Kell and Lewis. The various methods for blood grouping are slide or tile method, which is the most commonly used, tube method, microplate and automated method. Landsteiner law was proposed by Karl Landsteiner. If a particular antigen is present on the surface of RBC, corresponding antibody is not present in the serum of the patient. Law 2. If a particular antibody is present in the serum of the patient, corresponding antigen is not present on the surface of the RBC. We describe the tile method, which is most commonly asked in your examinations. We take a tile and place one drop of anti-sera A, which is blue in color, anti-sera B, which is yellow in color, and B reagent separately on a labeled slide or tile. The sample which is given to you, add one drop of that into each of the anti-sera. The cells and reagent are mixed with a clean stick. Wait for 5 minutes and then look for agglutination with the naked eye. This is the equipment we use for the tile method: anti-A blue, anti-B yellow, anti-DS red in color. This is the tile where we place the anti-sera and add the blood. Interpretation. If agglutination is seen in anti-A, absent in anti-B and present in anti-D, it is B positive. Agglutination is present in anti-B and anti-D but absent in anti-A, it is A positive. If all the three slides show positive result, it is AB positive. Similarly, B negative, A negative, B negative and AB positive. Other questions which are frequently asked are, what do you mean by cross-matching? Cross-matching is of two types, direct and indirect. In the direct cross-matching, recipient serum is taken and the donor RBCs are taken. These RBCs are washed, suspended in saline, and we have to observe for agglutination. This is usually done to prevent antibodies in the recipient serum which give transfusion reactions. Indirect, donor serum is taken and the RBCs of the recipient are taken, washed, suspended in saline, added, and we see for the agglutination. Finally, the adverse effects of transfusion. They can be immediate or delayed. Immediate, febrile reaction, hemolysis, allergic reactions, going on into anaphylactic reactions like rash and itching, transfusion associated circulatory overload and lung injury, bacterial contamination of the blood. Delayed reactions are the delayed hemolytic transfusion reaction, transfusion of infection, finally iron overload. The next question which they will be asking you, what do you mean by erythroplastosis fetalis? This is a hemolytic disorder of the newborn. RH negative mother, when bearing a RH positive baby, the first delivery is uneventful. During the second delivery, mother has already developed antibodies against the RH antigen, leading to hemolysis, which is called as erythroplastosis fetalis. Recently discovered blood group is the Bombay blood group. It was discovered in 1952 and it is characterized by the absence of A, B, H antigens on the red cells. The serum of these persons contain anti-A, anti-B and anti-H. The difference between Bombay blood group and O blood group is Bombay blood group does not have H antigen, whereas O blood group has H antigen but A and B antigens are absent. This is how we differentiate both of them. Lastly, Coombs test used to demonstrate presence of IgG antibodies against the RBC in the patient. They can be direct and indirect. Thank you. Thus we conclude the session on blood grouping, and our next video will be reference smear examination part 1.